Hello, it's Greg Grizzled and Gaijin. We're back. We hope you're having a happy day wherever you're listening to this audio content from. As always, we'd like to thank you for your continued support of Greg Grizzled and Gaijin social media and writing efforts. Thank you, thank you, thank you. This is episode 047 of the Greg Grizzled and Gaijin, definitely not a podcast show. A light and fluffy look at social media, Japan, Japanese food, expat life, and life in general. As always, your retweets of this and all the wonderful, wonderful, wonderful content that we actively tweet and retweet out on Craig Hoffman 11 on Twitter is appreciated. Thank you in advance for helping us get the good word out about Greg Grizzled and Gaijin. Welcome back. Another good show today, I hope. Talking about health checks in Japan. First, a disclaimer. This is not meant to substitute for any real medical advice that you may get whether you're living here in Japan or wherever you are going to your medical professionals. Their opinions certainly should usurp mine. And it's also to tell you that I'm perfectly fine. I plan on living a long, long time. I have no issues at all. But over the past few months, I didn't know that that was the case and if I was going to be okay. And I thought, talking about that, whether you're a young expat living here or one who's been here quite a long time like me, it might help save some people some stress and grief. So let's do it. Japanese health checks, for those of you who don't know, it's generally a condition of employment. Employers get some sort of tax kickback for actually paying for the health checks, as I recall reading somewhere. And like anyone, when I came here 14 years ago, I was an assistant language teacher, and my school made me do a basic health check. The people actually came to the school, chest x-ray, and some urine analysis. Nothing major. And of course, I was younger then, and I really had no fear of passing any sort of health check like that. I left that job and I had a little time. My wife made me go to a full health check at a clinic near my house. And I went through all the paces and I got my paper in the mail about 2 or 3 weeks later, and I was fine. And I said, see, you made me go to the health check for no reason, and we wasted money, which was very little. It was like $60 or something for a full health check. I started a job, and they, of course, required a health check as a condition of employment. And I went in, full scans and chest x-rays and the works. And about 3 weeks later, I got my health check results, and they were perfectly fine. And I said, see, man, these health checks are a waste every year. Come on. You know, I'd take the morning off. I can't eat. And the next year came, and the next year, and I passed, and I passed. Then I turned 40. And I went in, and now there's a whole new battery of tests. They're doing things like lung capacity, stomach checks, eye exams for retinal scans and things. And I went in, and I'm still thinking, I'm 40. And they took a picture of my eye, and they couldn't do the left eye. And again they tried. And again they tried. And the clinician, or technician rather, who was there, called another nurse over, and they tried again. And I see like this panic look on the nurse's face. And I'm like, in Japanese, I'm like, am I okay here? Like, what's going on? And they said, well, just sit here and wait, right? So they all leave me. And it's kind of dark in the room, right? I'm like, this can't be good, right? And they bring a doctor in. I mean, they run in to take another, or try to take another picture of my eye. And they can't do it. And they're like, oh, and now I'm like panicked, and I think I've written or talked about it before. I was literally in tears. And they said, well, don't worry. It just didn't happen today. And about 3 weeks later, I get the health check report, and nothing is really listed for that problem. And I thought that was a little curious. So I went to the local eye doctor, and I had the same scan twice, actually, for 2 different doctors. And he said, you're fine. The next year, my health check showed a couple of problem areas. You get like this A, B, C, D kind of mark. And it was lower. And I was a little surprised. Still, the health check said, maybe if you have time, go. But they found no serious problem. So I'm like, I'm okay. My wife's like, it happens. You were sick a little. You run yourself ragged. You work really hard. I didn't think anything of it. This year, in January, I went into my health check after the New Year's. I had influenza about 3 weeks before. So I have a little condition, all right? So I'm not feeling 100%, but I got to do this health check. In fact, I canceled once, and I had to go back. And again, about 3 weeks later, I got my health check information. And now I've failed things. And it comes with a stack of paperwork, all in Japanese, of course. And my wife and I sat down, and she helps me go through it. She's like, you got to go to the doctor. I'm like, I'm perfectly fine. I feel great. And this exam is telling me I've got a serious problem. She's like, but you got to go to the local doctor. So I took a morning off of my company, and I went. And the doctor reviews my healthcare chart. And he goes out with a nurse into the waiting room, and I hear this loud clang and my wife's voice. And I think that she has passed out from the news. And now I'm really in tears when they come back in. My doctor's like, what's going on? I'm like, I don't know. You were out there. I hear this loud bang. His diploma had fallen off the wall. And he said, well, you should probably calm down. I said, thank you. And he goes through the list and my exam and in Japanese, and suddenly he says in English, early cancer. And now I'm really like crying. I'm like, early cancer. I'm 43. Early cancer. Early cancer. I said it like that like 4 times. Turned to my wife and one more time. Early cancer. And my wife kind of shook her head. And the doctor went through, and he's still unmoved. You just told the patient he has early cancer, and you didn't seem really upset. And he went on in Japanese. And really, his English translation, early cancer, was pre-cancerous possibility. Whew. Score 1 for Google Translate there, right? And so I calmed down a little bit, and I left, and I scheduled an appointment at a bigger hospital. I needed a test done that you can be awake for, but trust me, you don't want to be. And you can only do that at the big hospital. And I went into the hospital, and I intake through all that stuff as you have to do. And that was not too difficult. There's some Japanese questions. They ask you a lot about allergies and prior medical conditions. And of course, I've been a really healthy person, thankfully, most of my life, and especially all of my adult life. They ask things, are you allergic to this or that? I don't know. I've never taken anything. Have you had this or that? I don't know. I've never been to a doctor for that. So that was a little hard. If you're a really healthy person, you actually have a bit more trouble answering those questions than if you've had some doctor visits in your history, right? So he says, hey, we'll get you taken care of. And I set up an appointment, and that's about a month later. And I went in for the procedure in the morning. Again, you got to go early. Intake. It was all pretty easy. I would definitely take a Japanese person with you if you didn't speak Japanese. I could have done it probably alone, but I was glad, especially with the stress of the situation, to have my wife with me. And I went in and I had it done. And this week, the next day, actually, after the procedure, I go into the doctor again. I had a scheduled appointment. And he says, you've got a couple problems. And he didn't seem really worked up. And I said, and then in the middle again, this doctor in English, he did his best to explain it in English. Clearly, he had done some research and looked up some words. He was pretty good, actually. And then he jumped back into Japanese for more of like where all that leads. And suddenly he says, you have a few problems. And then in English, however, I'm like, oh. And he puts pictures up of the exam on his computer screen. And I'm thinking, this is where it hits the fan, right? This is where Gray, Grizzled, and Gaijin ends quickly. And he's like, oh, but it's not really an issue. You're going to take some medication for like a week and you'll be perfectly fine. And my heart just like, wanted to jump out of my chest. I felt really great. So he schedules me for a follow-up to make sure that I took my medicine. And you will go to the doctor several times here in Japan. There's just no getting around that. He just simply wants to ask me, did you take your medicine? And I'm going to say yes. and then that will be that. But we left, and we got the prescriptions for the medicines, and they're all really common medicines, nothing serious again. And I went next door to the pharmacy. There's some rule here, like you can't sell drugs in the doctor's office or in the hospital. I think there was a time in Japan where doctors were kind of prescribing a little too many pills, as I remember reading somewhere, and they were double dipping, as it were, into the insurance, and they didn't like that. So it's right outside the hospital. Literally, I walked like 10 meters, and there's the pharmacy. And I walked over. There's also near a shopping mall, which was good. I sat down, and my wife's like, well, what do you want to do? I'm like, man, I want to go somewhere, and I'm going to order something big, like something unhealthy. And I ordered these huge French toast waffles with blueberries and strawberries and like this big cup of coffee. And I sat down, and she even took a picture of me. Maybe I'll post it on Twitter. That is like the happiest face I have ever made in my entire life, to know that I was not sick or going to be going through months and months or even years of treatments. And wow. But I was talking to another former foreigner, my friend Braden, who I've mentioned before on the show. And what a wonderful opportunity to gain perspective of life. And of course, I'm a really positive and happy dude, and I live life every day like it could be my last. And if you walk in any Japanese streets with the way people drive these days and bicycle, it very well could be your last. You got to be careful out there. But when I sat there waiting for my procedures, I was surrounded by old people. And not only old people, but really sadly sick people. And clearly they were regular patients there. The nurses were really good and kind with them. One old woman was showing the younger nurse the best vein to give her her medicine because the others had been worn out. Another old man was so sick that they had to basically almost push him out of his waiting chair and go in. And there was another nurse who kind of shook her head at another patient and didn't really say much when she asked, am I going to be okay? And I'm no doctor, but it was clear that short of some miracle, that woman didn't have very much longer to go. And so it was a sobering experience for someone like me, again, who had spent an adult life super healthy. And you realize, and I had written this on my private Facebook, I didn't say anything about this on Twitter intentionally so, but my friends and family knew that I was having some health trouble. And I said, I learned that old age and death come for everyone, even me. And it was really interesting on a personal level for me to realize that no matter how fast and strong I am, little by little, those days are coming for me. But this time, I dodged a bullet, and I'm most happy and fortunate about that. So, if you get a health check that's not perfect and you have to go in, don't sweat it. These health checks, in my opinion, catch stuff really early. And that's a fortunate thing for a better chance at a positive outcome. And I've known other foreigners in Japan who have run into serious health trouble. But through world-class medical care and universal health insurance, they've been able to bounce back and resume normal lives. So there is hope for that. But in the end, whether you're healthy or sick or today is your last day, I hope you take a moment each and every day to be thankful for today. That's it, and have a great day.